Well, September is Gynecologic Cancer Awareness Month. It's a time to spotlight the cancers that impact thousands of women each year. Here with more on the warning signs, treatment, and importance of early detection is gynecologist Dr. Tori Clark with Memorial Health System. Thanks so much for joining us today.
Thanks for having me and for shedding light on such an important topic.
For sure, and the topic covers a wide range of different cancers too. You got uterine, ovarian. Tell us all about what you do.
There's 5 gynecologic cancers that can affect the reproductive system. You've got cervical, uterine, ovarian, vaginal, and vulvar. So hopefully here to shed light on a little bit of all of those.
Yeah, and with cervical cancer, that one's a little bit easier because there's a screening process, vaccines, but when it comes to ovarian cancer, that's usually like a silent killer, right?
Right, and that's why awareness is so important for the majority of gynecologic cancers, because we don't have great screening protocol in place. But for pap smears and for cervical cancer specifically, we've actually greatly reduced the amount of cases over the past 40 years of cervical cancer just due to earlier detection and things like that. So that's why it's really important to stay up to date on those.
Yeah, and for Mississippians, I mean, the stakes are even higher because we have very high rates of cervical cancer here.
High rates of cervical cancer, high rates of mortality in general associated with our cancers. I know you touched on ovarian cancer. It can be one of our more sinister diagnoses because it presents so late and the symptoms tend to be very vague. So bloating, abdominal pain, pelvic fullness, things that a lot of women overlook often at times. So really important to highlight that if you're experiencing those things, that you bring it up to your physician.
Why do you think Mississippians have higher rates of that type of cancer?
You know, Mississippi tends to fall on the lower side of a lot of our health statistics, and gynecology is not separate from that. So we really, as Memorial, we like to encourage all of our patients to use this month of gynecologic awareness to schedule your appointment with your physician and to start these conversations about prevention and see if you might be particularly more at risk than the general population.
And when it comes to warning signs with those other cancers, what are some things people should look out for?
Always abnormal vaginal bleeding, abnormal discharge, like we said, the bloating, the pelvic pain. Don't ignore those symptoms. Certainly much better to have a visit and have everything check out okay than to miss something that could potentially be a warning sign.
Are you able to detect those other cancers with pap smears, or is it just the...
Pap smears are actually specific to cervical cancer, but if you're having some of these other symptoms, there are different things we use to investigate, just not typically as a screening protocol. Right. And hopefully that will be changing in the future and as we get more research and developing those things.
Yeah, and of course early detection is important, just like with any cancer, and treatment options for these. What do those look like?
Yes, absolutely. Well, early detection in general gives you more options, better options, and really advancements in gynecology have led to more minimally invasive surgery. Advancements in oncology have led to more targeted therapies. So definitely early detection plays a key role here when we're talking about our treatment options for our patients.
Dr. Clark, we thank you so much for your insight.
Thank you so much.
Hopefully people will take advice and come get screened, get checked out.
Absolutely. Come see us at Memorial.